everyone, welcome back to a new post today. Sustainable Development Goals, as we all know, have to be achieved by 2030, and they not only speak about the sustainable planet, but they speak about many human-centric goals that need to be achieved by 2030. And one of them is good health or access to health for all. Now, under that component of Sustainable Development Goals, the United Nations has pledged to eliminate TB by 2030. But India has been way ahead. The government of India has pledged to reduce or eliminate TB from India by 2025, much before the intended timeline of the Sustainable Development Goals by the United Nations. Recently, the WHO Global Tuberculosis Report of 2023 was released, and it gave up some startling details about India with regard to TB incidents or tuberculosis incidents in India. Now, along with this global tuberculosis or TB report by the WHO, the government of India also brings its own India TB report, and it brought out this report very recently in 2023. Now, what I found was there was a mismatch between the global tuberculosis report of 2023 and the government of India tuberculosis report as well. And let's have a quick a short critical analysis about actually what exactly is the government doing, and is it enough to eliminate TB from India by 2025, keeping in mind that we have just 1 or 2 years to go, and we have 7 years to achieve the Sustainable Development Goals, keeping in view the incidence and the number of cases in India. So let's have a quick review about this. Now, tuberculosis, as we all know, is a communicable disease. It spreads from one person to another, and it is a major cause of ill health and one of the leading causes of death worldwide. Now, tuberculosis is caused by bacteria. It's caused by Bacillus mycobacterium tuberculosis, and it spreads when an infected person or a sick person who is infected with TB expels the bacteria by air, by coughing, etc. So the WHO Global Tuberculosis Report provides a comprehensive, up-to-date assessment of TB epidemic and progress in prevention, diagnosis and treatment, which are the 3 important steps for any treatment of disease at the global, regional and country levels. Now, this is done with the context of global TB commitments. One of them is the Sustainable Development Goals to be achieved by 2030, and the strategies and targets as well. Now, the 2023 edition of this report is, as usual, based on the data gathered by the WHO from the national ministries, along with India, the Ministry of Health and Family Welfare, and which of annual rounds of data that are collected by the ministries. In 2023, 192 countries and areas with more than 99% of the world's TB population and TB cases reported data have been studied and released. So what exactly is the data given regarding India? So India, it says, accounts for the highest number of TB cases in the world as of 2022, representing a staggering of 27% of the global burden. That means India carries almost a quarter of the TB cases in the on the globe. This was revealed by the WHO Global TB Report of 2023, which brings out the data of 2022. Overall, 30 high burden TB countries accounted for 87% of the world's TB cases in 2022, and among the top 8 high burden countries are neighboring Indonesia, China, Philippines, Pakistan, Nigeria, Bangladesh, our very close neighbor, Democratic Republic of Congo, etc. So we can also relate the high incidence of TB cases in India because we are very, very close to these countries which have a high incidence of TB, like Pakistan, Bangladesh, China, etc. are our neighbors itself. And definitely people who migrate or the illegal inhabitants or the immigrants to come to India, mostly TB is found in the lower sections of the society. So they persist with that. They don't treat themselves because they take it for it. They take the cough which persists for a long time as granted, and they just deal with lowering down the existing symptoms of cough. So one way of predicting why India has such high cases is because of the neighboring countries also. Now, according to the report, India has 2.8 million, which is 28.2 lakh TB cases in 2022, with a case fatality of 12%. So the report highlights that the multi-drug, now there is a mismatch between this data and the data given by the Ministry of Health and Family Welfare. The India TB report of 2023 says that we have 24.2 lakh cases in 2022, while the WHO report says that there are 28.2 lakh TB cases in India. Now, the report highlights that multi-drug resistant TB remains a public crisis in India, with 1.1 lakh cases recorded in 2022. Again, here there is a mismatch between the WHO data and the Ministry of Health and Family Welfare, which says that there are 63,300 cases of multi-drug resistant TB in India. India, Indonesia, Philippines, which together account for 60% of the global reduction in the number of newly diagnosed TB patients in India in 2020-21, all recovered beyond the pre-pandemic levels, and this is a good news. The report shows that India has made progress in reducing the number of cases from 258 persons per 1 lakh population in 2015. It has dropped to 199 per 1 lakh in 2022. There is a mismatch between this data and the data given by the Ministry of Home Affairs also, which says that it is 172 per lakh population. But the WHO data says it is 199 per lakh population. But the rate is still far higher than the global average of 133 per 1 lakh population. So we are almost 50 units ahead of the global average. The case fatality ratio, ratio, which is the measure of how severe the disease is of India, stood at 12%, which means 12 out of 100 patients died because of TB in India. The figure is double the global average of 5.8, which is 5 or close to 6% in 100 persons in the world died due to TB. Singapore has the lowest case fatality ratio of just 1%, while China stood at 14 spot with only 4%. While TB is curable, the death can occur when it is diagnosed very late and there is on and off or irregular taking of the medicines also. And whenever it is accompanied by graver diseases such as HIV and other health related issues also, which attacks the immunity system. Now, the government is working not only for diagnosing the disease in India, treatment and prevention, but was also dealing with TB comorbidities, supervision, monitoring, patient support systems as well. The center is partnering with the private sector to deal with TB patients in India, which usually do not come out in the open. There is a National Tuberculosis Elimination Program, previously which was called as the Revised National Tuberculosis Control Program, aimed to strategically reduce the TB burden by 2025. As I told you, much ahead 5 years of the Sustainable Development Goals. There is a National TB Elimination Program which is being implemented by the National Health Mission. The Pradhan Mantri TB Mukt Bharat Abhiyan is being implemented. Under this, Nikshay Mitras, who are helpers who help in diagnostic, nutritional support and vocational support to those who have been affected by TB treatment, and the government has also encouraged not only the normal people, the lay people, but also elected representatives, corporates and also NGOs and individuals to come forward to be the Nikshay Mitras, that is the donors, to come forward to help the patients in the TB journey, in their journey towards recovery. Now, there is also the TB Mukt Panchayat initiative, official pan-India, rolled out just last year by the government for shorter TB preventive treatment at the family-centric care model for TB. There is a national strategic plan for TB elimination, which was launched to achieve the target of ending TB by 2025 in the mission mode. And there is a universal drug susceptibility testing, which is being implemented under the National TB Elimination Program, which is to ensure every diagnosed TB patient is tested to rule out drug resistance, especially before or at the time of treatment initiation itself. Now, under the TB, let's have a look at which are the states which have a high incidence of TB per 1 lakh population. So there are some states which have low TB incidence. For example, states in the northeast, like you have Nagaland, which has only 172 per 1 lakh population. There is Kerala with 67. There is Karnataka with 111. Tamil Nadu with 126 per lakh population. On the other hand, we have high states like Haryana with 250 people per lakh TB patients in Haryana, 230 in Uttarakhand, 218 in Uttar Pradesh, Madhya Pradesh with 214 per lakh population, Rajasthan with 209 and Gujarat with 213. So when the government is working, the target has to be especially these states which have a high incidence of TB population per lakh. Now under the National TB Elimination Program, there are key activities that are underway. For example, state and district specific strategic plan for targeted intervention, especially in the high burden areas. Provision of free drugs and diagnostics for the TB patients, also the drug resistant TB patients. Active TB case finding campaign is being taken up to key vulnerable and comorbid populations. There is integration with the Ayushman Bharat, and health and wellness centers are now catering to screening treatment to the TB community. Private sector engagement is being taken by the government for initiatives like notification of the TB cases, if any, and also management of the TB cases. Scale up molecular diagnostic laboratories at the sub-district levels and not only district level. Nikshay Poshan Yojana, nutritional support for the TB patients. Intensified IEC campaigns to reduce especially the stigma, because most of the time the TB patients do not come into open because of the social stigma. People look at them as untouchables. They do not want to talk to them, sit beside them. The whole family faces a trauma because it is communicable. And this the government is also raising awareness and improving health seeking behavior. Multi-sectorial responses with involvement with line initiatives, scale up TB preventive therapy to contact pulmonary TB patients, and tracking of the notified TB cases with a portal called as Nikshay portal. These are the steps taken by the government, but how far definitely is going to work. So many of the people do not come in the open. They take the cough for granted after even diagnosis. They do not take the medicines on a continuous basis. TB needs sustained consistency taking of the medicines and also treatment. So any stop of the treatment in the between and a long gap leads to multi-drug resistance treatment, which is another state of severe treatment. Many people do not know about this. They overlook diagnosis, they overlook prevention, they also overlook the treatment as well. Nutrition goals are not taken care of by the people. So the government definitely has to focus first, number one, on the high the states which have a high incidence of TB. Number two, focus on the nutritional strategy mainly of the TB. Number three, track the patients, ensure that they are taking the medicines on time, and that too consistently. Especially maybe they can ask the Anganwadis to do so, or the health and wellness centers to do so, and also private sector participation as well. And this will help to achieve the goal of TB elimination definitely, if not by 2025, maybe by 2030 for sure. So this is about the recent WHO global TB report and some of the gaps between the national TB report that was released and what are the steps to ensure that TB can be eliminated, keeping in mind that we still have 28.2 lakh people with TB and it's not easy to eliminate TB so fast. So consistency, dedicated tracking and treatment, and also tracking with regard to the consumption of the medicines on time, and also nutrition needs will definitely pave the way for elimination of TB from India and achieving the sustainable development goals. So I hope this information was really helpful to you all to lay the foundation for this, because health and wellness is one of the important topic in UPSC GS Mains paper 2, and also from your essay part also with regard to government policies and initiatives in various sectors, especially health. So this was for today, and please do not forget to like, share and subscribe, and don't forget to comment, and I shall see you in my next post. Until then, it's very happy learning.